Or said wait. Okay. The Cuyahoga County Committee of the Whole meeting for Tuesday, December 5th is now called to order. Andrea, would you please call the roll?
Good afternoon, everyone. It is 3:05 p.m. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll. Ms. Turner. Ms. Turner is absent at the moment. Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Simon. Ms. Simon is absent at the moment. Mr. Kelly.
Here.
Mr. Miller.
Here.
Mr. Sweeney is absent. Mr. Tuma.
Here.
Mr. Gallagher.
Here.
Mr. Schron. Ms. Conwell is absent. Council President Jones,
Here.
you have a quorum.
All right, thank you. Andrea, has anyone signed in for public comment?
No public comment has been submitted.
All right, well, at this time, the items referred to committee.
I would like to say first, items A through N were introduced at the November 28th council meeting and referred to this committee. If there are no objections, the items will be referred out of committee with a recommendation of passage to the full council under second reading suspension, Rule 9D. Resolution 2023-0349, amending Resolution 2016-0218, dated December 13, 2016, as amended by resolution numbers 2018-0067, 2020-0061, 2022-0049, and 2023-0020, which authorized a grant in the amount of $2,500,000 to Variety Properties, LLC, for the benefit of a project located at 11801-11825 Lorraine Avenue in the city of Cleveland, by extending the resolution sunset provision from November 30th, 2023 to May 31st, 2024.
All right, at this time, Director Hurdig, you may present.
Paul Hurdig, Department of Development. Council President, members of council, this is the Variety Theater project. It has been somewhat of a long-running project. The current status is that the developer, Kelly Flamos, has in fact taken ownership of the project and has secured financing to make necessary repairs. The roof was in bad shape, so she's stabilized the property. At the request of council, and also because there's administration money in this as well, I conducted some due diligence on the present status of the project. I talked with representatives of the City of Cleveland and also the Local Initiative Support Corporation. Both organizations are reviewing requests for financing, and it's my judgment there's a reasonable likelihood the project will be able to secure the needed financing with the 6 months extension. And therefore, I recommend a further extension of 6 months of the sunset date of this authorization.
All right. Well, at this time, I will ask for a motion to refer.
Mr. President,
Question, Councilman Miller? Question.
this item is in Councilman Sweeney's district, and he requested that I report that he was contacted by the administration about the need for this extension and that he supports it and asks for the support of the council members. Thank you.
Excellent. So again, as for the motion being referred to the full council, again, as I said, with the recommendation for passage under a second reading suspension, as of the rules of tonight's council meeting. Do we have that first
So moved.
Second.
and a second? All those in favor say aye.
Aye.
Opposed? Ayes have it. The resolution is adopted.
Resolution 2023-0353, amending the 2022-2023 biennial operating budget for 2023 by providing for additional fiscal appropriations from the general fund and other funding sources, appropriation transfers, and cash transfers.
Good afternoon, council members. Trevor McClure, County Council staff. Before you today is a council-sponsored fiscal agenda item that would transfer $1.3 million from the general fund reserves to the Public Works Capital Project for the Veteran Services Headquarters build-out. If this council recalls, in April of 2022, the county approved the purchase of the building located at 3950 Chester Avenue for $1.825 million to be the new headquarters for the Veteran Services Commission. Since then, council has authorized either budget transfers out of the Veteran Services operating budget or the Veteran Services Fund at year's end, the surplus, totaling nearly $7.4 million to the capital project. This $1.3 million, if it's approved today by council, would have a total renovation project of $8.76 million. And so, working with the administration, this would fill the remaining gap to complete the first floor of the project and to have the second floor space available for admin staff of the Veteran Services Commission. And Public Works plans on bidding this project out in early January. The bids will be out for at least 30 days, hopefully with an award to the full council for approval sometime in February or March after Public Works completes the review of the bids.
All right, any questions at this time? Comments?
Just a comment that this project is now getting close to moving forward and being built out. I'm the sponsor of this, and I'm a believer that we should not be tapping in, as we've done in the previous years, into the Veteran Service Commission funds. Those funds are for the veterans. This transfer is from the capital budgets and from general fund, which is where all the other counties actually utilize for additions for the Veteran Services bricks and mortar. And so I'm glad to see that we're doing that. And if the county executive wants to look at that for doing anything on the second floor, that's certainly within his prerogative.
Councilman, this general fund transfer will allow, moving forward, any surplus from the operating budget of the Veteran Services Commission moving forward would go into the Veteran Services Fund that would be available to go back to our traditional awards to veteran services.
Any further comments or questions? If not, at this time, I'll ask for a motion to refer this item to the full council agenda with a recommendation for passage under second reading suspension of our rules.
So move.
Second.
Properly moved and seconded. All in favor, say aye.
Aye.
Opposed? Ayes have it. This item will be referred as the previous one was as well.
Council President, I would like the record to reflect that Ms. Turner and Ms. Simon are in attendance.
Thank you. Let the record reflect.
Resolution 2023-0354, authorizing a subsidy agreement with Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County, governing the use, disbursement, and oversight of Health and Human Services levy funds for the initial period of January 1st, 2024 through December 31st, 2025.
Thank you, Council President. Michael King, council staff. I'll be speaking on the next two items at the same time because they're both related. As I think you're all aware, the next two items before you today are agreements intended to memorialize and govern the Health and Human Services subsidies that the county provides to both the Adams Board and the Metro Health System. Historically, the county has provided these subsidies without formal agreements in place. So in many ways, this is simply an intent to memorialize the ongoing relationship. These are both two-year agreements that begin on January 1st of 2024, and they're intended to run concurrently with the county's biennial budget cycle. The term of both agreements will renew automatically every 2 years unless terminated by either party with at least 90 days notice before the end of each two-year term. The agreements don't commit the county to provide a minimum funding levels in future years. That process and decision will still be made as part of the biennial budget process and council's discretion. But in a nutshell, these agreements accomplish three primary things. First, they specify in broad terms what the county's subsidy dollars can and cannot be used for. In the case of Metro Health, the subsidy will continue to be used for charity patient care. And in the case of the Adams Board, it will continue to be used for the provision of mental health addiction, prevention, treatment, and recovery support services and related administrative expenses. Second, the agreements establish regular reporting requirements whereby each entity would provide quarterly reporting, including high-level information about how the subsidies have been used and the number of county residents served. The county would, of course, reserve the right to request additional information if necessary. And then third, it establishes a basic disbursement schedule whereby the county will make monthly pro rata payments of the budgeted subsidies each year so that both the county and the recipients can operate with some level of predictability in terms of the cash flow. I would like to thank all the council members who have provided support and feedback to staff throughout the process of negotiating these agreements, in particular council members Schron, Conwell, and Council President Jones, who all played an active role in both kickstarting this conversation and in bringing negotiations across the finish line. So with that, I'd be happy to take any questions.
All right, any discussion?
Council President?
Yes.
Since Mike King is presenting them consecutively, may I read the second item into the record so that they can be approved consecutively?
You may.
Resolution 2023-0355, authorizing a charity care services agreement with Metro Health System governing the use, disbursement, and oversight of health and human services levy funds for the initial period of January 1st, 2024 through December 31st, 2025.
All right, if there are no further questions, comments, or discussion, I will ask for a motion to refer the first item, Resolution 2023-0354, to the full council agenda with the recommendation for passage under second reading suspension of the rules at tonight's council meeting.
So move.
Second.
Properly moved and seconded. All in favor say aye.
Aye.
Opposed? Ayes have it. The resolution is referred. Now I will ask for a motion to refer Resolution 2023-0355 to the full council agenda with a recommendation for passage under second reading suspension of the rules again at tonight's council meeting.
Mr. President?
Yes,
before-
Councilman.
Before raising that, as Mr. King pointed out, that there are some parallel aspects of this, but there are oversight agreements on both of these, and these are independent. These are separate, even though they might have they're being read into the record on a parallel path. I just want everybody to understand that these were negotiated as an independent activity for oversight of the responsibilities, what was going on in Metro, and oversight responsibilities of what's going on in the Adams Board. And so I don't want anyone to think that I was proponent of saying that if you don't have one, you don't have the other. No, these are independent activities. All the funding is independent. Any changes to the funding is independent, and the oversight is independent. So I just want to put that on the record that that's my belief as to how it's being presented.
Okay, thank you, Councilman. And again, I ask for a motion to refer this item.
So move.
Second.
Properly moved and seconded. All in favor say aye.
Aye.
Opposed? Ayes have it.
Resolution 2023-0357, confirming the county executive's appointment of Emily Gar Passetti to serve on the Greater Cleveland Regional Transit Authority Board of Trustees for the term March 4th, 2023 through March 3rd, 2026.
Good afternoon, Council President. Zoe Toscas on behalf of the County Executive. Pursuant to Chapter 306 of the Ohio Revised Code, I'm here to recommend the appointment of Emily Gar Passetti to serve on the Greater Cleveland Regional Transit Authority Board of Trustees for the term that began March 4th, 2023 to March 3rd, 2026. We are requesting a second reading suspension, please, and Emily is here to present.
Emily, the floor is yours.
Thank you so much. And thank you so much for inviting me to be here. It's an honor to be with you here this afternoon. My name is Emily Gar Passetti. I am Vice President and Community Affairs Officer at the Federal Reserve Bank of Cleveland. That means I oversee outreach and research related to lower-income people and communities in Ohio, parts of Pennsylvania, West Virginia, and Kentucky. So to the question of why I'm interested in serving on this board, it's difficult to design remarks, especially briefly. This role is appealing to me both personally and professionally. On a personal level, I am a proud fourth-generation Clevelander, born of Lebanese immigrants. And I left when I was 18 from Cleveland, but I am now twice returned. I now live with my husband and 3 children, ages 7, 6, and 3 in Shaker Heights. In 2021, we moved there intentionally to live in a place that was accessible to transit, and we're now on the Green Line. Professionally, my background is in urban and regional economic development, and I have always had an orientation to using research to identify solutions to social problems, particularly solutions that benefit lower and middle income families. I have held roles at the national and local levels, starting my career at the Brookings Institution, Metropolitan Policy Program in Washington, D.C., and then back here in regional philanthropy at the Fund for Our Economic Future, the Rockefeller Foundation in New York City, and back here to my current role at the Cleveland Fed. Professionally speaking, what I know is that it is a critical time for public transit here in Cleveland and across the country. In my work to identify barriers to upward mobility for low-income families, the issue of transit access frequently comes up. How do we better move, how do we better and more efficiently connect people to jobs? Remote work is here to stay. Demographics are changing. Many suburbs are becoming older and poorer. And the connection between our suburbs and city is critical. But this all requires that the greater region, the RTA is responsive and adaptive to the changing needs in the environment. I admittedly have a lot to learn about the operations of RTA, but I am committed to listening, to learning, and to contributing to the extent I am able to ensure that this transit system serves the public with efficiency, innovation, and equity in mind. I welcome any questions that you have.
All right, at this time, are there any questions?
Through the chair, yes. All right, thank you. How are you this afternoon, evening?
I'm doing okay. I'm happy to be here. Thank you.
Thank you for your willingness to serve. I had a couple of questions. I think you answered the first one about the biggest issue as it relates to our current public transportation system, and you talked about access. My very specific question is about the school district. It is my understanding that the Cleveland Metropolitan School District's agreement with RTA allows the students to use their school IDs to ride the bus. And although this is a great program, I was surprised to learn that the IDs cannot be used after 5 p.m. So I'm hearing that this is negatively impacting the students' ability to participate in after-school programs and activities. Is this something that you would be interested in addressing as a member of the RTA board?
Yes, and these are exactly the types of issues that I am really looking forward to kind of delving into more and learning about the complexities, why we have the policies in place that we do, and contributing to the extent I can to a solution.
So what's the first step you're going to take to try to address this problem?
Like I said, I am not an expert. I don't know the depth or the details on this particular issue. I think where I can contribute is with a broader lens, and without more information, I'm not going to speak to any particular issue, but I assume that as I get onboarded, I will be equipped with the details and the information that I need to move the ball forward, and you bringing it up at this meeting is the first step.
Okay, thank you.
Thank you. Any further questions? All right, if not, I will entertain a motion to refer this item to the full council agenda, again with a recommendation for passage under second reading suspension of the rules at tonight's council meeting.
So moved.
Properly moved and seconded. All in favor, say aye.
Aye.
Opposed? The ayes have it. The item is referred.
Council President, can I clarify who seconded?
Seconded by Councilman Tuma.
Thank you.
Thank you.
Resolution 2023-0358, making an award on requisition 13202 to Kefleitner Automotive, Inc., in the amount not to exceed $824,432 for the purchase of replacement new, never titled, 7 Dodge Ram 4500 trucks for use by the Sanitary Division. Excuse me.
Good afternoon, everyone. Tom Pavich from the Department of Public Works. We're recommending an award to Kefleitner. This is to replace 7 Ram box-style trucks within our sanitary division. They're specifically used with our sanitary house trucks, so they house a lot of different equipment, sea snakes, camera trucks, all kind of additional tools. They will be replacing 7 older age vehicles. I believe 5 of them have already exceeded 100,000 miles. By the time these get ordered, the other 2 will be nearing that threshold. This was a competitive formal bid. Kuffletner was the low bidder by just over $5,000.
And any questions, discussion? If not, I will entertain a motion again to refer this item to the full council agenda with the recommendation for passage under second reading suspension of the rules at tonight's council meeting.
So moved.
Second.
Properly moved and seconded, and we're going to give it to Councilman Toomer so he can, all is in one for this meeting. Yes, yes, all right. So it's properly moved and seconded. All in favor say aye.
Aye.
Opposed? Ayes have it.
Thank you.
Resolution 2023-0359, authorizing an agreement with Northeast Ohio Regional Sewer District in the amount not to exceed $2 million for disposal of wastewater sewer grit for the period January 1st, 2024 through October 31st, 2025.
Nicole English with Public Works. So this is our agreement with the sewer district that we do annually. And this is our sanitary division, what they suck out of essentially the sewers and the grit. We take it to the sewer district and they dispose of it. And so we pay them by the tonnage to do that. And we bill back the communities where that's come from.
All right, any comments, discussion? If not, again, we will entertain a motion to refer this item to the full council agenda with a recommendation for passage under second reading suspension of the rules at tonight's council meeting.
Se-
Properly moved and seconded. All in favor say aye.
Aye.
Opposed? The ayes have it.
Resolution 2023-0360, making an award on requisition 11582 and authorizing a purchase and sale agreement with 10991 Memphis Avenue LLC in the amount not to exceed $1,200,000 for the property located at 10991 Memphis Avenue in the city of Brooklyn. Permanent parcel number 431-05-011, effective upon signatures of all parties at this time. Thank you.
Nicole English again with Public Works. So this is, you might remember, we've been kind of piece by piece selling off some of BODD's buildings that they're no longer using. And so Public Works, they run the sale of it. So we put out an RFP earlier this year, have been back and forth. There was 2 bidders that came in. We were negotiating with the 2. A committee made up of both Public Works and members from BODD score the 2 proposals, and this had been deemed the best proposal. It's also the highest priced proposal that they're getting from the building. And so we do have some representatives here from BODD if you have any questions, but we're recommending the sale to this company that is an LLC, but it was RAP Commercial is who submitted the proposal.
All right, any discussion?
Mr. President.
Councilman Miller.
To Ms. English, what do we know about the intended use?
So they're intending to use it for business, essentially. They're looking at medical laboratory type operations, but they've got a plan that's putting, they're buying it for $1.2 million, and they plan to put $2 million of investment into the property in order to have it a working business.
Thank you.
Any further discussion? If not, all those in favor of?
I'll make a motion.
Thank you.
Second reading suspension.
Second.
Properly moved and seconded. All in favor say aye.
Aye.
Opposed? Ayes have it.
Resolution 2023-0361, authorizing a cooperative agreement with Olmsted Township for a preventative and routine maintenance of 22 miles of county roads and various structures for the period January 1st, 2024 through December 31st, 2033, in the amount not to exceed $6,500,000.
Nicole English with Public Works again. This is our maintenance agreement with Olmsted Township. For those people who were here, council members who were here 10 years ago, I can't believe it's been 10 years, that's when we first executed the first maintenance agreement. The county is responsible for 22 miles of county road in Olmsted Township. And 10 years ago, we worked out an agreement with the trustees where, because they have the staff and equipment in the township and we really don't, they perform the maintenance for us. In turn, we pay them. The original agreement was $500,000 a year. That's what they've been operating for the last 10 years. Prices have really gone up, and it has kind of handcuff them as to how much work they can do during the year. Snow removal is their biggest cost that they do, so they plow and salt all the county roads on our behalf. So we have increased this amount to $650,000 a year. They do provide receipts to us to show that they're spending it on appropriate uses related to the roads and the bridges. So this agreement would begin next year. The reason we're executing it now is we do a prepayment so that they have the funds in their bank accounts to start executing these contracts, especially with this winter season coming. And so we are presenting it now in order to get approved before the end of the year.
Is there any discussion?
Mr. President,
Councilman Miller.
to Ms. English, what's the funding source?
Road and bridge.
Thank you.
Any further discussion? If not, we'll entertain a motion.
I so move.
All right, and again, this will be for second reading suspension at tonight's meeting. Properly moved and seconded. All in favor, say aye.
Aye.
Opposed? Ayes have it.
Resolution 2023-0362, making an award on requisition 13433 to the Great Lakes Construction Company in the amount not to exceed $8,018,591.97 for rehabilitation of North Main Street, Bridge number 00.12, over the Chagrin River in the village of Chagrin Falls.
Nicole English with Public Works. This is Councilman Schron's favorite project. Finally, 3 bids. We finally have a bidder that we can work with. So the engineer's estimate was $8 million. We had 1 bid come in, just over $8 million, $8,018,000 and some change. Great Lakes Construction is a quality firm. We have reviewed their bid, even though there was only 1. We feel it's still a successful bid to move forward with. We do have federal funding that's paying for majority of the project. This is a super complicated bridge project in the center of Chagrin Falls. If you've ever been to the popcorn shop, you know exactly where I'm talking about. It's on one of the news stations' morning show. It's the picture they show. So this is going to be a complicated project, hence the cost and the reason it took 3 bids. We are planning to start construction in February of 2024 and be completed by the end of 2025. It won't be closed for traffic in all that time, but there will be construction activity during those times.
Move to adopt?
Second.
Properly moved and seconded. All in favor, say aye.
Aye.
Opposed? Ayes have it.
Resolution 2023-0363, authorizing an amendment to a contract with AT&T Corporation for Internet Service Provider and Distributed Denial of Service Security Services for the period January 1st, 2019 through December 31st, 2023, to extend the time period to December 31st, 2028, and for additional funds in the amount not to exceed $826,000.
Good afternoon, council members. Matt Ruby, Department of Information Technology. This request in front of you is a 5-year extension to our contract with AT&T for our primary internet service. So this caters to all of our executive and non-executive agencies so that we can access the internet.
All right, any discussion? If not, we'll entertain a motion to refer to the full council.
I so move.
Second.
Properly moved and seconded. Again, this is under second reading suspension for tonight's meeting. All in favor, say aye.
Aye.
Opposed? Ayes have it.
Resolution 2023-0364, authorizing an amendment to a contract with AT&T Corporation for wide area network links for the time period January 1st, 2019 through December 31st, 2023, to extend the time period to December 31st, 2028, and for additional funds in the amount not to exceed $984,393.
Matt Ruby, Department of Information Technology again. This is a companion contract with the one that was just read. Whereas the first one was the internet access itself, this one is for the physical infrastructure for all of our agencies to be able to connect to the internet for daily operations.
Any discussion?
I'll move referral to council on second reading suspension.
Second.
Properly moved and seconded. All in favor, say aye.
Aye.
Opposed? The item is referred to the full council.
Thank you.
Resolution 2023-0365, authorizing an amendment to a contract with Caremark PCS Health, LLC, for pharmacy benefit management services for county employees and their eligible dependents, and Cuyahoga County Benefits Regionalization Program participants, employees and their eligible dependents, for the period January 1st, 2022 through December 31st, 2024, and for additional funds in the amount not to exceed $30,183,128.
All right.
Good
Floor
afternoon.
is yours.
Thank you. Sarah Nemestel from the Department of Human Resources. This resolution seeks to amend the county's current agreement with Caremark CVS, under which CVS serves as the administrator of the county's prescription drug benefit plan. The contract ends at the end of 2024 and is going out for RFP early next year. The current not-to-exceed amount in this agreement is $53 million. We are requesting to increase the not-to-exceed amount by an additional $30 million. The majority of the additional funds in the not-to-exceed are needed due to the way rebates are processed under this agreement, which is different from the process applied under the prior agreement with CVS. Specifically, under the prior agreement, CVS applied the rebates in the form of credits to our invoices, whereas under the current agreement, the county receives payments for the rebates. So we now need to increase the not-to-exceed amount to account for the gross expenditures rather than the net, because the original not-to-exceed amount was based on the net. The remaining additional funds are needed due to cost increases for prescription drugs. Our prescription drug benefits have increased at a higher annual rate, and so the additional $30 million is just the not-to-exceed amount, just to remind that. We do not anticipate exceeding or even meeting this amount. This is the highest amount our consultant believes we might pay. We believe that roughly 21 to 24 million of that 30 million accounts for the rebates. This contract had its first reading on November 28th, and it was referred to committee, and we are respectfully requesting a second reading approval.
All right, is there any discussion?
Chair?
Yes.
Okay, so this contract update was needed due to the increase in drug costs as well as changes to the reimbursement process. How is the dollar amount of this contract determined?
So I will invite Stephen Witt, our business service manager, up here to help me with this. But I think, this contract was awarded back in 2021, correct? And at the time, it would have been based on projections from our benefits consultant for increases. And we've pretty much been on par, but prescription benefits have been a little bit higher. Am I correct, Stephen?
Stephen Witt with Human Resources. So just a reminder for everyone, the county is self-insured. So while we pay CVS to administer the program, any prescription drugs from that county employees receive, we are paying the full cost for. So along with our medical care, which is a similar thing where we're paying the full medical costs, it's hard to project. So our benefits consultant with their actuaries does calculations and did so in 2021 when we were awarding this contract. And at the time, we didn't catch that it was the net amount. Since we've had quite a bit of inflation over time, last few years, those costs have in addition to the rebate issue, those costs for those prescription drugs have increased above our original projections.
And then what services are being covered by this contract?
Any employee prescription drug prescribed to the employees.
Okay, thank you. Through the chair, that completes my question.
Any further discussion? All right. If not, let's let the record reflect that Council Vice President Cheryl Stevens is in attendance. And with that, all those in favor say aye.
Aye.
Opposed? Ayes have it.
Council President, we need a
moved.
in a second.
First, second by
Second.
Council.
Thank you.
All right. Move to the next item.
Resolution 2023-0366, making an award on requisition 12168 to the James B. Oswald Company in the amount not to exceed $700,000 for professional employee benefits consultant services for the period January 1st, 2024 through December 31st, 2026.
Floor is yours.
Thank you. Sarah Nemestel, Department of Human Resources. This resolution seeks an award to the James B. Oswald Company to serve as the county's professional employee benefits consultant. Oswald Services will support and supplement the work performed by our HR benefits team and provide a valuable outside resource for consulting, assistance, and recommendations concerning the evaluation, analysis, and financial management of the county's benefit packages. Oswald is the incumbent vendor and has served as the county's professional employee benefits consultant since April of 2016. We awarded the contract to Oswald through competitive bid, and it was the highest scoring vendor. Though Oswald's pricing was not the lowest, it was still the highest scoring vendor overall, and their pricing for consulting is a flat fee and was only slightly higher than the lowest flat fee proposed. The total contract is for 3 years and has additional fees built in for other services, pass-throughs, and dependent audits for each year, which are not covered by the flat fee. But we see these services as being very important. Will provide a cost benefit to the county. Again, the dependent verification audit, and then anytime we need third-party actuarial review of our plans. This contract had its first reading on November 28th and was referred to committee, and we are respectfully requesting a second reading approval.
All right, any discussion?
Mr. President.
Start with Councilwoman Stevens and then Councilman Miller.
So do we use, from the chair to the director, do we use the full 700 on average?
I will defer to our business service manager,
So
Stephen.
we've had this since 2016, correct? And so on average, do we use the full amount?
Even with Human Resources, on average, we use about $150,000. The previous contract, the current expiring contract, is hourly based, so it's based upon usage. We feel that with a new director of HR and a new benefits director, that we will end up utilizing a lot more, so we feel confident that we will get our money's worth out of the flat fee.
But if we're averaging 150,000, why are we going to 700,000?
So
That's a big jump.
It is. One of the things that was not included in the previous contract that we have in this new contract are funds for pass-through services, particularly a dependent audit to audit all of our dependents on our plans to make sure that anybody on those plans are actually eligible dependents, which we have done in the past for significant cost savings.
And what was the cost of that independent audit?
Previously, those independent audits were about $50,000 a year.
So if I doubled this, because we have a new director and a new manager, that's 300,000, and then I kick in another doubling of the audits, that's 100,000. So we're still not at 700,000. And if we've been careful about our budgets, and I mean, we really, as a council, have been beating ourselves up with the staff about these budgets. This is more than doubling.
This is $700,000 over a 3-year period. The prior contracts were $150,000 per year. This contract is about, the flat fee is about $162,000, and then with that, we have about $70,000 built in for the dependent audit, and those are pass-through fees per year.
Okay, thank you. Mr. Chairman, I still think this is too much. If they're averaging 150 a year, and then they do 50,000 for audits, that's still 200,000, and in 3 years, that's 600,000. The body can do what it wants. I've been out there by myself before, but this doesn't add up.
Well, Council Vice President, what we can do is we could hold this and have it to committee. It doesn't have to be passed tonight, and we could go through the committee process.
Thank you, Mr. Chairman.
Mr. President.
All right. Councilman Miller, would you like to weigh in?
Yes. Ms. Stevens covered a lot of what I wanted to ask about, but I had one other question, which is how many bids were received and who were they?
So the county received 4 proposals from vendors, including Oswald. The other vendors were Siegel, Engel, Hambright, and Davies, Inc., and Highland.
Okay.
And Stephen, I don't know if you want to kind of explain what you had explained to me about the difference between the bids. That some were true brokerage services, whereas this is consulting based.
Sure. So of those 4 bids received, one of Two of those vendors were acting as true brokerage services, where their costs were significantly higher because they would then share the fees that they receive by being a broker. So then, if we go with the vendors they suggest, we would receive a portion of what the fee they receive. But that goes against the county's efforts to have full competitive bids, because that would just be going with a recommended vendor. The other two vendors, the two highest scoring, were Oswald and Seagull, who both offered flat fee services and a full comprehensive benefits consulting service.
Okay.
Mr. Chairman, just for the record,
Thank you, Mr.
I
President.
get what we're trying to do. I understand the quality of services. I just don't like their price points.
Through the chair,
This item will be referred to committee. Yes,
if I may.
yes, please.
What were the DEI provisions, and was Oswald's proposal compliant with the recommendations?
Yes, so the DEI set a 3% small business enterprise and a 7% minority business enterprise goal for this contract. Oswald and Siegel, who was the second highest scoring vendor, whose flat fee was just slightly below Oswald's, not slightly, but not significantly below. We're both the only DEI compliant vendors and met the goal.
Thank you, Mr. Chair.
All right. Any further discussion on this item? Again, if not, we will move on.
Council President, I want to clarify, this item will be held and it'll be referred to the HR committee next year?
Yes.
Okay, just wanted to make sure.
Items for discussion.
Items A through G are for discussion only. No vote is required, as these items are being submitted for introduction at the December 5th council meeting. If there are no objections, the items will be considered and recommended for passage under first reading adoption under suspension of rules 9D and 12A. If committee members decide they would like an item to be referred to their designated committee for further discussion next year, the recommendation will be made at tonight's council meeting. Resolution 2023-0369, awarding a community development grant in the total amount not to exceed $600,000 to the City of Fairview Park for the purchase of real property located at 21125-21139 Lorraine Avenue in the City of Fairview Park.
Mr. Chair, Trevor Meckler, County Council staff. I am requesting if you're willing to send this to Community Development Committee for next year discussion. In discussion with Councilman Kelly as the sponsor, we would like the city to come in and present their overall plan for this parcels, for the parcels in a fuller explanation due to the time. It's not time sensitive compared to the other items today.
Okay, we will hold it.
Thank you.
Resolution 2023-0371, declaring that public convenience and welfare requires the resurfacing of Bagley Road from Front Street to Lindbergh Boulevard in the city of Berea in connection with the 2024-2027 Transportation Improvement Program. Total estimated project cost, $4,736,111.
Nicole English with Public Works. This is step one of a roadway project, which is welfare and convenience that we're presenting today. This was funded through NOACA at 80% federal funding, and so we have a proposal with the city of Berea to split the difference, 10% county, 10% the city, and for the rest of the construction funding. So this is our traditional 80-10-10 program that we would use. The street was resurfaced in 2007. Last, the project would be construction for 2027, so 20 years later. It carries 23,000 vehicles a day, so it's a pretty highly traveled road. And we would, once this passes, we would begin design and work on the project, and it would come before you once it's the contract is awarded, but that would be not until 26 or so.
All right, is there any discussion? If not, this resolution will be introduced at tonight's council meeting for consideration for passage under first reading suspension of the rules.
Resolution 2023-0372, authorizing an economic development loan in an amount not to exceed $700,000 to Neighborhood Healthcare, Inc., doing business as Neighborhood Family Practice, for the renovation of 13027 Lorraine Avenue, Cleveland, to provide various medical, dental, and pharmacy services to people of all ages, regardless of their ability to pay.
Floor is yours.
Good afternoon, council members. Anthony Stella with Department of Development. To start off with, there's a proposed substitute, which I believe you all received.
Mr. Stella?
Yes.
That will be addressed at the board, the council meeting. This is for discussion only, so.
Oh, for discussion
yeah,
only,
so
so I
we
don't
won't
have
be
to bring
voting
this
on
up.
that.
Okay,
Yeah.
thank you. So I'm here to discuss a proposed loan to Neighborhood Healthcare, Inc., doing business as Neighborhood Family Practice. This is a nonprofit established in 1980, a 501c3 nonprofit. They have federally qualified health centers, 8 locations on Cleveland's west side and in the city of Lakewood. The majority of individuals that they provide services to are individuals in poverty that are navigating poverty. So as a safety net, they provide primary care, behavioral health care, HIV services, midwife services, pharmacy, and dental services to low-income and underserved populations. They've provided they have 64% lived below federal 200% of federal poverty level. 60% were Medicaid, 6% uninsured. A very diverse group of patients, and also they are the Ohio Department of Jobs and Family Services designated provider for initial health screenings for all refugees that are settled in Cuyahoga County. Their project that they're looking to that they're taking on, and I'm remiss to not reference that we have 4 members from the organization that are here today. They came in support: Dominic Hobson, Christine Porter, Terrence Byrne, and Gina Gavlik. They've all come to support. And the proposed project, they have a health center, 11709 Lorraine Avenue, which is 117th and Lorraine, and they will be moving to a larger center at 130th and Lorraine. This is going to allow them to provide more services. They've been seeking a larger site to be able to do this, and it was a long search, and they had been searching for something that was close enough, still on the transit route, so that so that all their patients would be able to get there. So they will be creating 13 new jobs and retaining 16. The loan is in an amount up to $700,000 and would carry an interest rate of 3% with a year interest only, followed by 10-year fully amortized. It's a $2.1 million total project, and I'll open it up to any questions at this point.
Any discussion? All right, if there are no questions or comments, this resolution will be introduced at tonight's council meeting for consideration for passage under first reading suspension.
Thank you, Council.
And Council President, at that time, the proposed substitute will be discussed.
Okay.
Okay. Resolution 2023-0373, authorizing an agreement with the City of Euclid in the amount not to exceed $839,744 for tenant-based rental assistance services in connection with the American Rescue Plan for Home Investment Partnerships Program, and it's for the period October 1st, 2023 through September 30th, 2025.
Good afternoon, County Council. I am Prentice Jackson, here on behalf of the Department of Housing and Community Development, requesting approval for a contract for the City of Euclid in the amount of not to exceed $839,744 for the period of October 1st, 2023 through September 30th, 2025.
All right, any discussion? If not, we will refer this item. It will be introduced at tonight's council meeting for consideration for passage under first reading suspension.
Thank you.
Okay, thank you.
Sir, can you state your name again for the record?
For the record, my name is Prentice Jackson Jr., Department of Housing and Community Development.
Thank you.
Thank you.
Resolution 2023-0374, authorizing an amendment to a contract with Microsoft Corporation for Microsoft Premier Training and Support Services for the period November 1st, 2017 through December 5th, 2023, to extend the time period to December 4th, 2024, and for additional funds in the amount not to exceed $860,036.
Matt Ruby, Department of Information Technology. So county operations are very heavily invested in Microsoft's products and services. So what this contract does is it provides our IT staff, both here at headquarters and also embedded across the agencies, to access Microsoft directly for support with product configurations, if there's ever questions or issues that arise, but they also provide educational resources for our staff to fully utilize the products and services that we get.
All right, any discussion? If there's no discussion, this resolution will be introduced at tonight's council meeting for consideration for passage under first reading suspension.
Thank you.
Resolution 2023-0375, making an award on requisition 12674 with Integrated Precision Systems, Inc. in the amount not to exceed $2,405,368 for security, monitoring, and maintenance services on alarm systems in various county buildings for the period January 1st, 2024 through December 31st, 2026.
Roger Mook, Physical Security Specialist, Sheriff's Department. This is a 3-year contract, maintenance contract for all cameras, access control, and alarm systems countywide for every owned and leased property of the county.
All right, is there any discussion, questions?
Yes.
Councilman Miller?
What was the procurement? Was there competitive bidding? How many bids were received?
3 bids. This was the highest point awarded to the IPS.
And why did we take the bid with the highest point?
They scored the highest on the test.
I see.
On when we scored the bids, they scored the highest.
And Mr. President, to the witness, how many? How did it differ on price?
One bid wasn't even competent. The other one was out of state. This bid incorporates our response to the medical examiner's office and the county jail, and we have a window in there that they have to be on site within 24 hours, and they couldn't compete with that being out of Michigan.
So, am I correct? It was decided mostly on capabilities and logistical questions as opposed to the cost of services. Is that correct?
It was combined with that, but they scored the best.
Okay, thank you.
We're going to provide the best service that we need.
Okay, any further comments, discussions? If not, we will refer this item. It will be introduced at tonight's council meeting for consideration of a passage under first reading suspension.
Resolution 2023-0376, authorizing an amendment to a contract with Alcohol, Drug Addiction, and Mental Health Services Board for the Mental Health and Substance Abuse Addiction Diversion Center for the period December 8th, 2020 through December 31st, 2023, to expand the scope of services effective upon contract signature of all parties, to extend the time period to December 31st, 2024, and for additional funds in the amount not to exceed $5,775,268.43.
Good afternoon, Council. Brandy Carney, Director of Public Safety and Justice for the county. Thank you for your time today. As all of you know, people experiencing a mental health or substance use crisis fare better and recidivate less when they're offered treatment in lieu of incarceration. The Diversion Center opened its doors in 2021 with the vision of providing an alternative to jail when law enforcement officers respond to calls. As we remain committed to this concept, this amendment furthers the mission of the Cuyahoga County Diversion Center and associated programming by extending all services for 1 year. The 1 year extension totals $5.7 million. The Adams Board receives $161,000 from that for two dedicated trainers. Frontline Services for their 24/7 hotline receives approximately $363,000, and Oriana House $5.2 million to operate the day-to-day for the diversion center. An RFP was done in September of '23. Only one bid was received, and it was from the current operator of the diversion center. Simultaneously, we became aware and engaged with planning for a combined crisis center and diversion center in the county. Because of these two factors, I'm requesting to do a contract amendment instead of a new contract. Over time, diversion center admissions have greatly improved. Achieving change within law enforcement is a lengthy process. While initial referrals from law enforcement were not as high as hoped, we made the decision late in 2021 to allow friends and family members to call upon the diversion center for help. It is our belief that providing the option to families can prevent their future to call the police in a situation that otherwise would be left to escalate. We are requesting a one-year extension on this contract so we can have time to assess operations using a third-party evaluator who will be paid using federal funds obtained through a congressional, set-aside. Additionally, we continue to work with the Adams Board and Metro Health Hospital to determine the best route forward for a crisis center. The crisis center model is one you've likely heard of. It's similar in mission to the diversion center, and at this point, all partners agreed to integrate diversion services as well as detoxification services at the crisis center so that we can maintain one place with both models integrated and functioning in partnership. Plans for this United Center remain in progress. Therefore, we wish to continue to operate the diversion center as a standalone center for 1 year, for the next year, so that we do not miss the opportunity to serve vulnerable populations while simultaneously continuing to train law enforcement and dispatchers to respond compassionately and effectively in crisis situations. And I'd like to add, I intentionally used the word we rather than I throughout my presentation. This entire project and process is really a collaborative effort. The Diversion Board and its membership are extremely knowledgeable and have a lot of engagement in the situation. The Adams Board, as we all know, has tons of knowledge in the situation. Other social service agencies in the county. Community advocates have been amazing. They're extremely knowledgeable. They attend our Diversion Board meetings and engage. So I just wanted to make sure that that came across to council today. And I'm happy to answer any questions.
All right, if there are no questions, this item will be introduced in tonight's council meeting for consideration for passage under first reading suspension.
I appreciate that. Thank you.
Items I through L are for discussion only. No vote is required as these items were introduced at the November 14th council meeting and referred to the Human Resources Appointments and Equity Committee. No committee meeting was held. If there are no objections, the items will be discharged from committee and dispensed with committee review under Rules 9D and 12S, and considered and recommended for passage under second reading adoption under suspension of the rules at tonight's council meeting. Resolution 2023-0314, adopting various changes to the Cuyahoga County Non-Bargaining Classification Plan A through C.
Good afternoon, Council President, Madam Chair of the HRA Committee. I'm Albert Bouchahine with the Personnel Review Commission. Before you are classifications and updates to the non-bargaining classification plan that were posted publicly on our website for viewing and approved by the Personnel Review Commission at their public meeting. We have worked closely with the Department of Human Resources along with department managements to ensure that they're fully aware of the changes that we're presenting to you today. You've also been presented a packet of information outlining, summarizing the changes, and with that, I'll be happy to answer any questions you have.
Through the chair. Hello. Are there any current employees impacted by these changes?
Madam Chair, there are currently 6 employees in the budget and planning administrator position. 5 of them happen to be under the minimum of the new recommended classification. If HR were just to place them into the new pay range, the cost would be approximately $15,102.
So that's the fiscal impact?
That is correct. At minimum fiscal impact. HR can decide to move them somewhere else within the band, but at a minimum, it would cost $15,000, Madam Chair.
All right.
Any further discussion? If not, we will move this item. It will be discharged from committee review and considered for second reading adoption under suspension of rules again at tonight's council meeting.
Resolution 2023-0315, adopting various changes to the Cuyahoga County non-bargaining classification plan, A through N.
Again, Mr. President, Madam Chair, members of the committee, Albert Bouchahine again. These are updates again to the non-bargaining classification plan that were posted publicly on the PRC's website and approved at a public meeting. You also have a packet for this resolution of changes, and I'll be happy to answer any questions you have.
Any questions, any
Mr.
discussion?
President?
Yes,
Okay.
Councilwoman.
What's the reason for the new position within the medical examiner's office?
They had changed the org structure. There was a position, there's a need for a position that was for a lead forensic photographer. They have 2 forensic photographers now, but they needed somebody to not only to be their lead worker, but also focus on attending committee meetings for the opioid task force.
Okay, and the fiscal impact?
This is a new position. I don't know if this is within their budget or not, but that's not something, we assume it is once it's requested of us.
Thank
So
you.
they'll post for the position and hire once it becomes effective.
Thank you.
Any further discussion? If not, again, under the rules, this item will be discharged from committee review and considered for second reading adoption under suspension of rules at tonight's council meeting.
Resolution 2023-0319, confirming the county executive's appointment of Tanisha Warren to represent Cuyahoga County on the Child Abuse and Child Neglect Regional Prevention Council for the Great Lakes region for the term January 24th, 2024 through January 23rd, 2026.
Zoe Toskis, on behalf of the county executive and pursuant to section 3109.172 of the Ohio Revised Code, I'm here to recommend the appointment of Tanisha Warren to represent Cuyahoga County on the Child Abuse and Child Neglect Regional Prevention Council for the Great Lakes region for a 2-year term starting January 1st, 2024 and ending January 2nd, 2026, and we are requesting a second reading suspension.
All right, Ms. Warren, the floor is yours.
Good afternoon. My name is Tanisha Warren. I'm a Cleveland native. I've lived here my whole life. I graduated from CSU with my bachelor's in social work in 2020. In 2021, I obtained my LSW. I became a licensed social worker. I then entered into the advanced standing program for social work at Case Western University. I graduated with my master's in social work in May of 2023. During my school career, I interned with ODJFS, Rainbow Terrace, and Fostering Hope. These experiences have shed a light to me, along with living in the community. The need to invest in families and children is essential. My concentration for my master's degree is community practice for social change. I am consistently thinking about the bigger picture in regards to serving our families and communities. I believe in our families. I just think that they need resources and opportunities systemically in order to help them succeed. I want to focus on building stronger foundations for the families. I believe that's essential. And being aligned with an organization that focuses on that is very important to me.
All right, thank you. Are there
Thank
any
you.
questions or comments, discussion?
Mr. President.
Miller.
To Ms. Warren, I'd like to thank you very much for stepping up and for your interest in child abuse and neglect prevention. And the next meeting of the Prevention Council is on January 11th, so the passage is needed this evening so that Ms. Warren can attend that meeting. And in addition to all of the assets that you bring to the table, the Great Lakes Council could benefit from additional diversity, and so we add that as well. And I would encourage my colleagues to allow this to go for passage this evening. Thank you.
Thank you. I appreciate it.
Councilwoman Turner.
Mr. President, just a quick question for you. I was listening to you cite your resume or your experience, and you seem very young. And I was wondering what drew your interest to this council, and being that you are so young, and that is an amazing thing. What do you feel that you can offer us in this position?
So, like I mentioned, I've lived in Cleveland my whole life. I went to CMSC schools my whole life as well. So, just personal experience, seeing the community, seeing the same generational cycles of needing better resources, needing, better examples, knowledge, things like that. I felt like I kind of got into social work because I want to provide my insight. I was a young single mom early on. My mom was a teenage mom. I just kind of feel like our community needs real programs, real resources that can benefit. So I guess just kind of like my real life experiences, family members, friends, just living in the community and recognizing the need for better resources and things like that, because honestly, you get tired of seeing the same generational cycles. And then also you get tired of being in rooms with the conversations where people say what they want to do, but the action is not taking place. So I wanted to be in those conversations, in those rooms where real action is happening.
You wanted a seat at the table.
Yes, ma'am.
This is very dark work, and I just want to thank you for your willingness to step up.
Thank you.
Thank you.
Any further discussion?
Council President?
Yes.
I just wanted to clarify. Zoe, can you state what the term is again, please?
Thank you, Andrea. I was just about to correct myself. I read the wrong term into the record. It is January 24th, 2024 through January 23rd, 2026.
Thank you.
Thanks, Andrea.
All right.
Thank you.
Just a question, Mr. President. Yes. So why would this be under suspension of rules? If the term starts the 24th of January, would there be an opportunity to read it at the next full council meeting in January?
Well, it could be. We were suspending the rules tonight and passing them on first reading, assuming there are no concerns. We did have one earlier where there were legitimate concerns, so we did hold it till committee. But we would pass it at the end of the year if this body feels comfortable with it.
Council President?
Yes.
Mr. Miller, would you like to speak to that?
So, I was under the understanding that the next meeting of the Prevention Council is on January the 11th, but if the term doesn't start until 1/24/2024, it sounds like Ms. Warren might not be able to attend that meeting. And I'm wondering why the term start date has to be this late, because this position has been vacant for some time.
I will call better representative of the actual board to the table.
Good afternoon, ladies and gentlemen. My name is Stephanie Penza, and I am from University Hospital's Rainbow Babies Injury Prevention Center. We are the coordinating entity for the Great Lakes Regional Prevention Council for the Ohio Children's Trust Fund. And we have been working very closely and very diligently with Councilman Miller to have Ms. Tanisha Warren's appointment hopefully start January 1st, 2024, so she is able to attend the council meeting, because we do need an additional representation from Cuyahoga County. The council has 4 counties within the Great Lakes region. Each county is supposed to have 2 representatives. So Ms. Tanisha Warren would be the second representative for Cuyahoga County. And then if she's appointed and her term starts January 1st, then she's able to be a voting member for the next council meeting.
So, Mr. President, could we amend the resolution so that the term date would start 1/1/2024 and go to 12/31/2025?
Council President?
Come forward, Joe.
Joe Nani from County Council. I believe what you might need to do is make the appointment for the unexpired term ending
the 1/1/23, because the terms are consistent, and then appoint for the full term 1/24/24 through 1/23/26 to do it the appropriate way. Is that correct, Zoe?
That would be correct.
Mr. President, so who's serving in this capacity now?
It's currently vacant.
How long has this been vacant?
So it has been vacant a few months. It is, part of the council is to find a representative who will provide expertise in child abuse and child neglect prevention work. We still are in quorum because we still have a current Cuyahoga County representative, but we need to make sure that we have, to the fidelity of our contract with the Ohio Children's Trust Fund, 2 representatives. So currently, it is a vacant position.
So is our Cuyahoga rep now Dale Miller, councilman?
No, it's Jennifer Grossman.
I see.
Yeah.
Okay. And who vacated this, who was the predecessor to this, this seat?
Carl Carlston, or, I'm sorry, last name was Culberston.
Carlin Culbertson.
Yes, yes. Why, I'm sorry, I got nervous with that question, but yes, he vacated the position because he took a new spot.
Okay, sorry.
No, I'm sorry.
Trick question.
Yeah,
It's
thank
funny.
you.
Can we have another trick question?
Go ahead.
1/1 and then 1/24. There's a gap there of 23 days. Just saying, since I'm the numbers girl.
We know.
Jack?
I'm a numbers guy also, and so it seems like an easy fix based on what Joe had talked about to appoint to fill the unexpired term beginning on January 1st to run to the 24th, and then go with a new schedule so that we aren't messing up too much with the budget. We're only picking up the 23 days that are uncovered. We're not starting it right now. We're not starting it to run through that, and we would pick up the unexpired term beginning on January 1st. Would that, Joe, would that be in compliance at that point?
Where is Joe? He ran away?
Yeah, easy. And that way it would satisfy both the January 1st start, the 11th date, and
The language that you could probably use is to appoint to the unexpired term ending 1/23/24, and then appointing for the full term that is on.
I got
here.
what you're saying.
Oh.
But we also have a budget folks over here that are going to pick up an extra month of, in regards to that position, would they not?
There's nobody in the, there's no one in the position, so.
But will we
And
not
to
be paying?
Councilman Tron,
No,
there's
they're
no
paying.
compensation.
Oh, there's no compensation.
No
compensation.
compensation.
Yeah. It's a moot point.
Yeah.
I can cover no
I
compensation.
just needed the dates clarified.
Oh, okay.
So I would say the language would be, again, to the unexpired term ending 1/23/24, and to the full term 1/24/24 through 1/23/26.
If there's no compensation, then,
No.
okay.
Now we're both happy.
You were thinking compensation too, I know you were.
But that was the second question.
All right, so at this time, we will make, if that's the proper protocol, we would make a motion.
No, no, no. No, we cannot. These are discussion items only. The proposed substitute would have to be addressed at the 5 o'clock meeting.
At the 5 o'clock meeting.
Correct.
You'll have that all written out correctly, so,
All right.
So the law department will,
or somebody.
They have time to
Or
get it
someone-
together
The law
before
director's
tonight. All right,
We'll have a
excellent.
proposed substitute
Excellent.
ready.
Thank you for your presentation.
40 minutes.
And we will see you this evening.
okay. Resolution 2023-0324, making an award on requisition 12552 to Moore Counseling and Mediation Services, Inc., in the amount not to exceed $590,850 for employee assistance program services for the period January 1st, 2024 through December 31st, 2026.
Floor is yours.
Good afternoon. Sarah Nemistel, Department of Human Resources. So this resolution seeks an award to Moore Counseling and Mediation Services, Inc., to serve as the provider of the county's Employee Assistance Program, which is part of the county's comprehensive employee benefit program for all benefits-eligible employees. Moore has served as the county's EAP provider since March of 2015, and we are requesting a new 3-year agreement based on the results of a competitive RFP process. The RFP was sent to 22 vendors and posted on the county's website from July 13th, 2023 to August 14th, 2023, and in strategic sourcing. The county received and evaluated 6 proposals in response to the RFP. Moore Counseling was the highest scoring vendor. Morris Counseling's pricing is $2.50 per employee per month. It's slightly higher than the average pricing of the proposals we received. However, our scoring committee noted that many of the lower price proposals were not comprehensive EAP plans and required additional fees and costs for services, so we're more of a, a la carte menu, if you will. As a comprehensive EAP program, Moore offers the best value for the cost. County employees may use the EAP to reduce stress stemming from personal and work-related issues that can negatively impact their performance, which in turn helps us retain valuable employees and promote a healthy work environment. These services include 6 free counseling sessions for employees and their families. The county can also utilize Moore in connection with critical incidents, consultation, training, and referrals when necessary. The county does have a high number of critical incidents, ranging from individual mental health crises to issues that require group intervention. And so it's great that all critical incident response is included in this cost. The contract also includes hours for wellness services, as well as unlimited mediation and conflict resolution services, organizational development services, short-term assessment screenings, and community resource referrals and listings. In addition, Moore Counseling does have counselors on staff as opposed to using a network of counselors outside of Moore. For purposes of this contract, DEI set a 10% small business enterprise goal. Moore was the only responding vendor that was DEI compliant and met the SBE goal. This resolution had its first reading on November 14th, 23, and we are respectfully requesting second reading approval.
All right, any discussion?
Mr. Chairman?
Yes.
From the chair to the director, when this says fully DEI compliant, what does that mean? Are the counselors diverse in ethnic bearing, or what do they have subcontractors they use? Because I'm concerned about who our people see.
Sure. So the Department of Equity and Inclusion sets the SBE and MBE goals. And I'll let Stephen Witt, our business service manager, speak to the specific goals for this bidding process.
Stephen Witt with Human Resources. So while we can't speak directly to what Director Lockett utilizes for setting these goals, typically the goals are set at as a percentage of contract value. And with that, Moore Counseling shows that the 10% of, at least 10% of this contract will go to an SBE firm, which I believe, not having the information directly in front of me, is themselves as a registered small business, minority-owned business.
Okay. That was my question. Is this a minority-owned company?
It is my understanding that they are registered as a minority-owned business.
Then I'm asking you to illuminate on that. That helps us understand that those staff members who need consulting with a different perspective, they're getting it from the very beginning, and I just wanted to highlight that, that's all. Thank you.
All right, any further discussion? If not, under Rules 9D and 12S, this resolution will be discharged from committee review and considered for second reading adoption under suspension of rules at tonight's council meeting.
Thank you.
If there's any miscellaneous business. If not, our meeting is adjourned and we will reconvene at 5 p.m. for our regular council meeting.